Okay, so who are you and what do you do?
My name is Alex Sherstvidov, and I work at ANKORS in Nelson. It's a regional agency that works throughout the West Kootenay boundary region, and we work with people who live with HIV and or hepatitis C, and people at risk, and people who use injection and or inhalation drugs, and community at large. We work with health and social service providers as well. And I guess one of the things I wanted to say is, because of the rural living, people think that there's no such thing as drugs out there, very little. Well, I'm here to say that there's a lot of drugs out in the rural communities, and there's everything there that you'll find here in the big city as well. And it's just about as easy to get. So some of the services we provide is needle distribution. So we have a mobile needle service, and we go through 16 plus communities in a 25,000 square kilometer area. And so we can't access a lot of people sometimes, like on Saturday and so on, so we have secondary needle exchanges. The people that we work with provide clean syringes and works and so on for people who are using injection drug use. What else? One of the other things we do is we have a festival called Shambhala, and at Shambhala we do drug testing, and so that has been helpful to minimize harms in using drugs, because we know that the drugs these days that you buy off the street are notoriously adulterated, and of course fentanyl is the big issue at this point in time with all the overdoses and so on. Sadly, we don't have a test for fentanyl. There is some fentanyl analogs that we can test for, but there are other analogs that we cannot test for, in particular 3-methylfentanyl and the new W compounds that are out there. These are synthetic opioids. They're very, very strong, and that have an incredible impact on people's lives, and in the sense of we've had over 300 overdose deaths since January. So at the Shambhala festival we do pill testing for other drugs that are out there, for ecstasy, for 2CB, 2CT7. There's all these drugs that people sell, and a lot of the times the pills that they bring are not what they say they are, so it minimizes the harm in that aspect as well. At least you may know what you're taking, and we talk about what the risks are and so on. So that's a harm reduction piece that we do at Shambhala. And also we're involved in a pilot project with interior health authorities to do testing, and we're trying to get more elaborate tests. I mean, the best thing to get would be a spectrometer, but those are very expensive, and at this point in time we don't have mass spectrometer. I can't remember the exact wording of it, which would tell you exactly what's in it. And there are agencies in Europe that have been using these, and yeah, so we're looking at that, and we're continuously trying to connect up with the community. And I think the key to doing some of this work is to have, Mayor, I think it was Philip Owens that had the 4-pillar push, and that would include treatment, enforcement, prevention and education, treatment, working with people who are like police and corrections, and harm reduction. And so that encompasses everybody, including people who use drugs. We want everybody to work together, sit down at the table and sort it out, because historically we have all the educated PhDs and so on sitting at the tables working, trying to sort things out, but not always including the people that are right in the thick of it. The people that are in the thick of it have a lot to say, and if we listen to people in the thick of it, I think we'll get a little bit farther. That's it.